Good afternoon, everybody. Can I just maybe have a slightly louder? Thank you. Good afternoon, everybody. It's my pleasure to sort of host this part of the World Obesity event that we're holding at UCLH. We have Professor Andrew Goddard from the Royal College of Physicians, and also, probably more importantly, we have one of our patients living with obesity, Angela, who's going to give her perspective as well. The purpose of today's session is to talk about obesity as a disease and also about the stigma that comes with people living with obesity and the new pledge that the RCP has taken to take steps to reduce obesity stigma. So I'm going to start by introducing Professor Andrew Goddard to say a few words.
Obesity is a word that brings off a lot of emotions to a lot of people, depending on their experience of it. What we know about obesity now is so much more than we did 20 years ago. And one of the reasons that the Royal College of Physicians has decided to push hard for obesity to be recognised as a disease and for people to really notice the stigma that obesity, living with obesity brings to them, fits with that. We know that most of the risk of somebody developing obesity is genetic, and most of the rest of the risk is to do with situations that they live in or they've grown up with, which are out with their control. Society has a huge part to play in this, and the rhetoric that we hear that it is all about personal choice, and if people simply just exercise more and ate less, is simply not the truth of it. We hope that by people recognising that obesity is a disease, that will allow us to have some really clear, structured ways that we can tackle this, because it is a major health issue, not just for our country, but for the world. And that as politicians recognise that it is something that people have very little choice about living with, that they will then support them to get through it. We can't underestimate the stigma that is attached to people living with obesity. Those little side looks that people notice whenever they walk in a room, little mutterings under people's breaths, this feeling that it's all their fault. We know medically that's not true. So as doctors, as physicians, we have to be their advocates. And that's why we're really quite vocal about this.
Thank you. So obesity as a disease is a contentious issue amongst healthcare professionals, but also amongst people living with obesity. And I know that a lot of people are against the idea that obesity is a disease. What's your view, Angela?
I totally agree. There are a lot of people that it's the fear factor of admitting or being told that you're living with a disease. The idea is that I'm living with the disease, I'm living with obesity, whether it's classified as a disease or not, I still have it. Actually having that classification and recognition within society and governments and policymakers to change the narrative around obesity can actually help me, because it will open up the access to treatments, to research, to stop the stigma and the bias. At the moment, it's still socially acceptable for me to be discriminated against in the street. People can shout abuse at me, call me names, make judgment of me, and there's no consequence to that. So if you're a person living with obesity, you become isolated, because for you to go out and go into a gym, me personally, I was in a gym and I had a man say to me, you know, do you have to sweat that much? Surely it's unhygienic. I don't want to be near you sweating that much. So that made me feel like I was completely worthless. And so why would I put myself back into a gym to be on the end of comments like that? I've been shouted at in the street, I've been made fun of, I've even been spat at for how I look, for being 24 stone. And it's that type of thing that needs to change, because if you don't witness that, if you don't live with obesity, you don't understand what it's like to go out into the world and just try and live a normal life.
So one of the calls is for doctors and healthcare professionals to understand more about obesity as a disease and its causes. How have you been impacted on by doctors in the way that they've spoken to you about your weight?
Well, to pick up on what Andrew said earlier, thankfully things are changing, and one of my first really bad experiences was like over 20 years ago when it was really bad, and I am proud to say that things are making a difference, but unfortunately everything has a consequence again. And at the first time I went for my smear test at my GP's office, and at 24 stone, I didn't fit onto the examining table. So I was asked to actually lay on the floor to have my smear test. And I was just completely mortified. I couldn't believe it. And so it took me another 20 years, and I've had bariatric surgery, which I'm very proud of. There's stigma and bias against bariatric surgery, but it's a great treatment to help people to live a healthier life. And so having the bariatric surgery and losing 12 stone, I got the confidence to go back and have my second smear 20 years apart. Now, that for me could have been life-threatening, because if I'd have, cancer wouldn't have been detected, if I'd have had cancerous cells, but that's how it affects you, because it was just so difficult for me to return back to a doctor's surgery.
Thank you. And what Angela's saying we know is true. We know that people living with obesity don't go for cervical screening, they don't go for mammograms, they don't go for colorectal screening. So how, in your position, can we impact upon the membership of the Royal College of Physicians and sort of change the narrative and change the way that doctors in particular talk to people with obesity?
I think the key is for people to reflect on their own preconceptions. We all carry around a baggage with us about what our beliefs are about the world and about the people we meet. And often some of those preconceptions are based on wrong judgments. So, you listen to stories like that and you can't help but think, gosh, I'm glad that wasn't me. And I think the more that we share those sort of experiences, and so that doctors understand what it's like living with obesity, the easier it will be for doctors and other healthcare professionals to relate to that.
And why do you think doctors don't ask questions to do with weight? It's very common that in a consultation we'll ask about other health-related issues, we'll ask about smoking and alcohol, but often even addressing weight isn't just even in the conversation.
So I think there are three main reasons. The first is what we've just talked about, sort of those preconceptions. Secondly, I think there is the whole issue of not sure which language to use, and worried that we might actually cause embarrassment or cause problems about it. And I think the third bit is lack of understanding about what the options are. We as doctors naturally want to try and help people to improve their health. And I think at the moment many doctors don't realise that there are lots of things that we can do to support people living with obesity, and there are lots of effective treatments that we can use. And so part of our job as the Royal College of Physicians is to help provide those resources, provide some education so people understand what, as doctors, we can do.
Just want to pick up on something that you've said and reflect it back to Angela, is language, and that language matters, and actually switching the language to describing a person with obesity rather than an obese person. I just want again to reflect back to you about your experience of how healthcare professionals have spoken to you.
Yeah, I agree. I think that there's a disconnect there because in past experience, I, again at 24 stone, went to my GP with an ingrowing toenail, and the GP told me, and the words were, you need to go away and come back when you're not so fat. Now for me to hear those words was mortifying. I left and didn't want to go back, and unfortunately 6 weeks later, when my toe was infected and I couldn't walk, I went back to see a different GP, and she was completely different. Her approach was different, and she dealt with the issue of my toe, and then she asked me, could she have an open and honest conversation about my weight? She asked me what I thought about my health, how I was sleeping. She asked me if I was permanently worried about anything, and she paid an interest to me as Angela and not just about my weight. And I think it works both ways, because like what Andrew said, GPs have a rough time of being able to, how do I approach this person without offending them? But it's because that person is already walking in the room. It's taken them so long to actually just walk in, because we're under the assumption that that GP is going to blame everything on our weight, because that's what's happened for so many years. And thankfully, again, things are changing. Doctors are becoming more aware of obesity and what causes obesity and the genetics. And it's not, I think it comes back down to the stigma that society thinks it's all my fault. I can do something about it. I need to go away and eat less and move more. When in fact, yes, eat less and move more is a good strategy for anybody, whether you're overweight, obese, or whether you're a healthy weight. It's good for everybody. But if you're a person living with obesity, you need to, think about your lifestyle, but you also need the support of the medical professionals, whether it's psychological, your mental health, whether it's a treatment, as in, a medication or a surgery, a support network. So if you're living with obesity, you need that extra bit of care, and that's what seems to be missing. And I think the education from the Royal College of Physicians to educate the GPs and all the other healthcare professionals to understanding the complexities of obesity. It's not just a one thing fits all, it is complex. And as soon as we can start doing that and seeing the person as an individual and using people first language, we'll conquer them barriers that are stopping people from getting the help and stopping the GPs from being able to help the people. It's working. I'm so thankful to the medical professionals, because if I hadn't have had that GP who, approached me in a different way and empowered me to want to do something, if I hadn't have had the bariatric surgeons who operated on me, if I hadn't have had the CBT support from the psychologists, I'd be dead today, and that's the bottom line. And it's because of the medical professionals that I'm here. And so we all need to work together to make a change. The patient needs to know that the medical professional is there to help them. And the medical professionals need to know that the patient needs their help, but they need them to understand and see them as a person first.
Thank you. Andrew, I'm sure there's been a lot of kickback about the concept of obesity being a disease and labelling 28% of the population and that it's going to bankrupt the NHS. What's your response to that criticism?
We know that obesity is a big problem for our health services, and that problem is worsening. One of the big advantages of obesity being a disease is it allows us to say we need to do more research. And one of the things that gives me a huge amount of hope is that we now understand the mechanisms behind obesity so much better than we did 5 years ago. People like you, doing research in the field, have shown that it isn't a personal choice, and that there are, pathways and the way our body responds to food and appetite and the hormonal regulation of appetite are critical in deciding whether someone is going to put on weight or not. And that gives me hope that through medical research we can develop effective treatments and move forward. If we just give up and say it's just someone's own personal choice, no one's going to invest in that, and we're not going to find the solutions. Having it as a disease shows that this is an important priority for the country, it's an important priority for medical research, and we will get there.
I think one of the other big concerns are the social inequalities to do with obesity, and we know that rates of obesity are much higher, particularly in children in areas with lower socioeconomic status. And again, what do you see as the role of the RCP in trying to address that?
There's a bit of speaking truth to power here. We've known about health inequalities, and that's to do with all aspects of health, but particularly with obesity, for over 40 years. And government after government, let's not be political about this, but every government has not managed to act on this. And it's sad that Michael Marmot last week, 10 years on from his original report, showed that we haven't made any progress when it comes to managing this. We know that your chance of being unhealthy and living with obesity as a child is substantially different depending on the deprived nature of where you live. And the children in our poorest community are far more likely to be living with obesity than the children in our richest communities. That's nothing to do, that's not their personal choice. That's nothing to do, that's where they live, what they've been exposed to. And it's as much to do with poverty as it is about anything else.
So the RCP have taken the pledge that has come out from the consensus documents from over 100 different professional organisations. And the first part of that pledge is to treat people living with overweight and obesity with dignity and respect, which I think says a lot, that we have to even put that as the first pledge. Again, how do you envisage that that message is going to be sort of cascaded out to the membership?
It will need role modelling, and I would be asking our trainers and our teachers with medical students to behave with patients, whatever conditions they might have, appropriately. It's also going to need repeating time and time again. These sort of changes in the way people behave aren't going to happen overnight. They will need reinforcing. And I would say to patients living with obesity, feel free to challenge us. If we say something that hurts, something that causes offence or causes a problem, let us know. Because most people probably say those things and they don't realise it. And it's the little throwaway comments meant in jest or just not really thought about, those ill thought through comments. And when they were pointed out, people go, oh God, you know, none of us are in the job to cause hurt, and perhaps we just need to be reminded. But I think we're going to have to keep going on and on about it. And I would hope over 5 years, 10 years, then we can really shift the culture and the way that patients with obesity feel when they meet a healthcare professional.
Should we see if there's any questions from the floor? I'm not sure if we've got a spare mic. Sorry. Any questions from people in the audience about obesity as a disease or about obesity stigma?
I'll go.
Sorry.
Hello. Thank you so much for this conversation today. The question really goes to how we take it forward related to obesity being recognised as a disease. We had a meeting in Parliament last year with the APPG on obesity, which we discussed, had world experts, including yourself, Rachel, discussing and patients, discussing the need for the government to recognise it. Unfortunately, then our health secretary came in and said, in essence, it's personal responsibility. So I'm opening up to the floor really to say, how do we move it forward when our government thinks it's personal responsibility, however the world experts believe that it should be recognised as a disease, and how we basically mend that gap?
Can I make a comment? I think that healthcare professionals are the people who get to decide if it's a disease or not somebody with no medical training. And actually, I think we don't get hung up in whether the government think it's a disease or not, but we move forward, get the message out, educate, and actually don't wait, and the government will eventually come along if they want to. That's my view.
Yeah, as a medical politician, I'll take a slightly different view. You need to get people on your side, and you need to win hearts and minds, and that's always quite hard. And I've discussed this with Mr. Hancock on a few occasions, and we both know where we both stand, so to speak. But one of the most powerful things is evidence, and the more evidence through research, through the feedback from both patients and the healthcare professionals looking after them about obesity, its impact on them, and the causes of obesity, I think we can begin to change that rhetoric. Because governments want to use the public purse to the best effect, and we have to help them to do that. And therefore, if they were just to focus on a personal responsibility, just exercise more, eat less, then that's not going to work, and that's going to be wasted money. So if we can make the financial case to the health of the population on these things, then they'll come round.
So Angela, you're part of patient groups, for example, Obesity Empowerment Network UK, and I know that there's sort of a lot of global conversation going on. In countries where obesity is recognised as a disease, do you get feedback from patients that it makes a difference?
Absolutely. There is an organisation called Adexo in Portugal that is run by Carlos Olivia along with his team, And Portugal recognised obesity as a disease, and this year they recorded that their levels of childhood obesity have actually come down. So it is having a huge effect. And for me personally, I believe that all we're doing by stopping obesity being classified as a disease is we're stopping people getting the treatment. For all the people that don't want to be classified as having a disease, you don't have to accept the treatment. There's many cancer patients that don't want to have chemotherapy. My mum died of lung cancer and she had a choice to have chemotherapy or not. She didn't have to. You know, there's many people that go through holistic approaches and they don't want to take the option of having treatment, and that's their individual choice, that's their person first choice. And if you are against having obesity classified as a disease and you're a person living with obesity, you're quite within your right to feel that way. But all you're doing by achieving that, all you're achieving by having that perspective, is you're stopping someone like me who does want to have treatment, who does need the psychological support, who does need the medical support. You're putting barriers in my way to stop me from getting help. And I think globally, there's all different countries where obesity is recognised as a disease, and it lowers the stigma and the bias, because at the moment, I can walk down the street and someone can shout abuse at me and there's no consequence. Someone can call me fat and there's no consequence. But if it was recognised as a disease, then it would have to have a consequence, because you're discriminating me because of something that's out of my control.
Thank you. And in terms of coming back to Matt Hancock's comments about personal responsibility, in terms of other diseases, for example, type 2 diabetes, what's the evidence that telling somebody they've got type 2 diabetes decreases their personal responsibility?
There isn't any. I think it's important for patients with any condition to have as good an understanding as they can to help them manage the bits that they can manage. And that's true for, I look after patients with colitis, and I would hope that the care that I give them is actually to do with us having an agreed way to move forward, and that's and having that shared understanding is much improved if there is an understanding by the patient about their disease, as well as an understanding by me as a doctor of what the patient wants and how they want to manage it. So just calling it a disease per se doesn't sort it, but I do think that it makes it clear this isn't something we can just dismiss, and I think it remains, whilst people say this is just something that is an individual's fault, people will continue to dismiss it.
So how do we change the narrative? How do we really make a step forward? So obviously events like today are a baby step. How do we change the narrative that obesity is just eat less and move more, to doctors and the general public accepting that obesity is a disease?
I go back to it. Repeated messaging, saying it time and time again. Normally with things like this, by the time you get so fed up with saying it, it's the first time that people really begin to listen and pick it up. So we've got to keep saying it. And it comes back again to evidence. And as a doctor, I'm pretty cynical about most things, and I need to see evidence to be convinced about stuff. So I was, obesity, where we were at, until about a couple of years ago, when I began to see the evidence and I began to understand the science behind it, and then I was okay and living with it, and I was able to make that own decision in my own head. So I think one of my jobs is to present that evidence to doctors so they can come to that decision on their own.
Angela, in terms of patient support networks, again, we have lots of support for people with diabetes, lots of support for people living with cancer. How do you sort of see the support networks for people living with obesity developing?
Well, I know for me personally, Obesity UK has had a huge impact for me as a person living with obesity. The work that they do within Parliament, governments and on social media to support people is phenomenal. It's a way of moving forward, and I think Obesity UK are coming together to speak as one voice, just like Diabetes UK, Cancer UK. We all need to work together, because this is obesity has a connection to all different other conditions, and so working together can support people. And again, it's lowering the stigma to know that it's not all your fault, and that there is, you know, a percentage of your body that is out of your control. Yes, you can eat healthily, you can be aware of the nutrition to use as a fuel for your body, you can make the right food choices, you can be as active as what you possibly can. But there comes a point where you're fighting against your natural biology and how you're made. And I think the support networks are vital to that, for people's mental health, to know that they're not alone. There's people out there right now that are at home thinking they're on their own, and that's why events like this is why I do what I do. Because for me, it's so emotional to know that medical professionals are actually fighting our corner, and we need to shout louder, and we need to get that message out there, so the person that's at home suffering knows that they're not on their own. And if it's okay, I would like to say, with regards to the government, I would like to ask Boris Johnson if he can be brave for people living with obesity, and if he can listen to the scientific evidence, and he can make a decision about whether he believes obesity is a disease or not, to move forward. But he needs to be brave and not follow his predecessors, because the Eat Less, Move More strategy isn't working, and so something needs to change. And the only way we can make that change, is by everyone working together, the governments, the media, medical professionals and patients. We need to work together.
And I think that's a key message for World Obesity Day, that actually we all need to work together, politicians, policy makers, doctors, researchers, the public, and also patients, to sort of change the narrative. And as you've already said, Andrew, we need repeated, consistent messaging that obesity is a disease, and that it's unacceptable to stigmatise people based upon their weight, be it underweight or overweight, because it's both ends of the spectrum. Do you have any closing comments before we...
Not really, just to reiterate what you've said. I think that the more we talk about obesity, the more we try to understand the view of the person living with obesity, the faster we can move this debate on. And I'm proud that, that we can offer our support, and we'll keep offering our support. And this is a big thing for us. We believe obesity is a disease, and we really want to do something about the stigma associated with it.
Thank you. I want to give the last comment to Angela, because I think it's the patient voice that's the most important.
Thank you. I'd just like to thank the medical professionals that are fighting our corner, that are trying to make a change, that face their own stigma and bias about what they're wanting to do. People disagree that obesity is a disease, and so the Royal College of Physicians has come out against negative comments, but they still keep supporting that, and that's it. That's a huge thing for me, and to the people that are out there living with obesity, for me, it's you're not alone. There are support networks out there. Please be brave. Please ask for help. If you can't go to your GP, or you can't, you don't feel confident enough, please go. There's online support that you can go to certain Obesity UK networks. There's all OEN, Obesity Empowerment Network. There's ECPO, which is the European Coalition for People Living with Obesity. There's support for you, and you just need to be brave, because you deserve to be treated with dignity and respect.
Thank you very much. I'd like to thank Andrew for coming during a very busy time. And in particular, I'd like to thank you for being so honest and speaking from the heart, and hopefully changing the view of a few people either watching online or here today. Thank you so much.
You're welcome.